Tonight is our fifth and final session in this series, and it will highlight the urgent need for harm reduction services in the state of Louisiana. According to the Louisiana Opioid Data and Surveillance System, drug deaths from 2019 to 2020 have increased by 70%. Syringe Service Programs can prevent the transmission of HIV and hepatitis C, reduce risk for overdose death with increased access to naloxone, reduce needle stick injuries to first responders and sanitation workers, and provide access to treatment when a program participant is ready. We're happy to have Hershey Krippendorf with us this evening. Hershey is the Director of Development at the Philadelphia Center, a community-based organization serving as Northwest Louisiana's HIV and STD Resource Center. The center provides supportive services to people living with HIV through Ryan White Part B funding, permanent supportive housing through the Mercy Center, and prevention services that includes HIV, syphilis, and hepatitis C testing. The Health Center for Gay, Bisexual, and Transgender Community, PrEP, PEP Clinic, and a Syringe Service Program. For the last 5 years, Hershey has promoted sexual health awareness and advocates on behalf of the harm reduction community. She has extensive nonprofit financial and management knowledge working in the sector for over 15 years. Prior to joining the Philadelphia Center, Hershey worked as the Director of Accounting at Providence House and the Accounting Specialist at Samaritan Counseling Center. She graduated from Louisiana State University Shreveport with a Bachelor's of Science in Accounting. Hershey, we're looking forward to hearing from you. Thank you for joining us, and I will turn it over to you.
Thank you, Mandy, and thank you everybody for joining us this evening. I know everybody's time is pretty valuable, and I'm hoping to be able to provide a wealth of knowledge to you about about harm reduction in our communities. So I'm going to share my screen. So like Mandy said, I am the Director of Development here at the Philadelphia Center. I also am overseeing the Syringe Service Program at the moment, and I have been a part of getting it launched here in the city of Shreveport. So I do want to talk about why it is so important to talk about harm reduction. So the Harm Reduction Coalition defines harm reduction as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. This is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. This includes how to safely use drugs, provide safe injection equipment to people who inject drugs. This is also the principle of meeting people of where they're at, regardless of what decisions that they have made throughout their lives. And addressing the conditions that happen, with long-term and short-term drug use as well. So our mission at the Philadelphia Center is to empower those living with HIV, eliminate new HIV transmissions, and enhance community wellness. And this includes everybody. So the goals of harm reduction is to improve the health and well-being of individuals, their partners, families, and communities. It reduces mortality rates, it empowers people and reduces stigma, and it eliminates the transmissions of diseases. And this also provides a bridge to health services that otherwise people who use drugs don't have access to. So we become a resource for people who use drugs to come to the program to get what safe injection equipment that they need, and to also, when they're ready to go to treatment, they have a place to come and say, hey, I'm ready to go. We do not push treatments. We don't push any testing on anyone. It is up to them to ask for those services. but we do educate them to let them know, hey, these are all the different services that we can provide for you. So to talk about examples of harm reduction that you see in your everyday life, utilizing a seatbelt reduces you from having to getting hurt in a car accident. A parachute is an example of harm reduction. Sunscreen is, utilizing condoms and lubrication and everything. Those are only a few of the examples of harm reduction that you'll see in your everyday life. It's not just about, sterile syringes and cookers and, those things. Everybody that's in this meeting right now, you are using an example of one of these harm reductions every day. Okay. So why harm reduction? It creates a safe space. It provides compassion. There is no judgment whatsoever when somebody comes to the Syringe Service Program. It's very loving. We're accepting. There is a social justice movement that is behind harm reduction, and there's a concept of leaving no one behind. Regardless of what they are doing in their lives, they also, need to feel humanized. So, and that's an aspect that we talk a lot about with our participants, is giving them, empowering them to feel like they are humans and that they belong and that they, that they mean something. So I do want to talk about, you'll see on the screen right now the fatal overdoses pre-COVID and during COVID, and you can see the increases that we in fentanyl overdoses from year to year, and it's just appalling. And the Syringe Service Program that operates at the Philadelphia Center is super important because we provide fentanyl test strips to each and every one of our participants. And we also educate them on how to test their drugs for fentanyl, because fentanyl is not only, it's not only just found in heroin. And that's what, in the past years, that's been the typical, substance that we found fentanyl in. That it is being laced in cocaine and methamphetamines. I've even had a participant that called me the other day and said that it looked like her marijuana had, a white substance that was sprinkled on it. So she's actually bringing her marijuana with her on Friday and is going to get a fentanyl test strip, and we're going to see if it actually had some fentanyl that was sprinkled on it. So you just never know where the fentanyl is going to be found. So. And this breaks it down, and these are all from the Louisiana Department of Health. And this is comparison from quarter to quarter for 2019 and 2020. I'm gonna give it a minute so y'all can absorb all this data. And I'm a gal that likes to dazzle people with data, so. So you can also see, as far as COVID, that there's the effects of COVID, for participants has been extremely stressful. There's been a loss of jobs and housing, and then just trying to maneuver around, of getting over COVID and not getting exposed to it. So. All right. So now we're going to talk about the actual syringe service program that we have here at the Philadelphia Center. We received an initial grant from the North American Syringe Exchange Network that helped to get us started. They supplied sterile syringes, some cookers, anything that we would need in order to get started without any funding. And according to their website, there are 450 syringe service programs nationwide, And we have 7 in the state of Louisiana right now. So I think Lake Charles is working on getting theirs through their local municipality. So what is an SSP? So it's a community-based program that ideally provides comprehensive services. And as you can see from this slide right here, we do not just supply sterile syringes, but also the safe disposal of syringes. We provide each one of our participants a sharps container. We also educate them with overdose treatment and education. And that is, we provide naloxone to all of our participants that want it. And we also educate them on how to administer the naloxone. We do, if our participant is interested in doing testing, we also test them for HIV, syphilis, hepatitis C, chlamydia, gonorrhea, any of the STIs that are out there, and they are willing to get tested, we will do that for them. So there's always, when we're at the beginning of doing our getting this passed through the city of Shreveport City Council, you know, a lot of the discussion that came about was about, well, SSPs, you know, they increase drug use. They don't increase, it does not increase drug use. If you give somebody that uses drugs or injects drugs a sterile syringe or a dirty syringe, that's which one they're gonna do. They're gonna pick. They're 110% going to choose the sterile syringe. And they're gonna do drugs regardless if we provide sterile syringes for them or not. So, you know, it is in our community's best interest is to supply sterile syringes and any harm reduction strategies that we can, you know, to people who inject drugs. Okay, so why syringe service programs? Public safety, money, overdose deaths, and access to treatments are only a couple of examples of why communities should have syringe service programs in their area. So public safety. So 1 in 3 officers may be stuck with a syringe during their career. Providing safe syringe disposal reduces needle stick injuries to first responders and sanitation workers. When we very first started doing our research and working with the Center of Behavioral Health, they did a little survey for us at CBH to ask the people who inject drugs, what did they do with their syringes? And you would be, it is appalling that some of them will either throw it in a ditch or they'll just throw it in the trash can. So those were 2 most seen answers to that question. So overdose deaths. So with us providing naloxone to each one of our participants, this reduces deaths by educating and distributing naloxone that reverses overdoses. And I believe Walter from CADA did a great presentation on how to use naloxone and why it is very, you know, it's important for our community to have access to naloxone. So SSPs are very cost effective. To treat a person that is living with HIV, it could cost up to $379,668, and this is according to the CDC. So we can either provide a syringe that costs us 10 cents, you know, to prevent the transmission of HIV or hepatitis C, or, you know, we can look at spending about $400,000 to treat somebody living with HIV. So with hepatitis C, to treat somebody with hepatitis C, it can cost between $20,000 to $40,000. And you'll see right here that, you know, SSPs are very cost effective when a sterile syringe cost is about 10 cents a piece, and it costs for each participant a year between $750 to $1,500 a year. And it also, syringe service programs also provide access to treatment. People who use drugs are 5 times more likely to enter treatment for substance abuse disorder and more likely to reduce or stop injecting drugs if they use an SSP. The syringe service program at the Philadelphia Center has referred out 12 people to recovery. So, and out of the 12 people, I want to say 6 of them I have not seen since they went to treatment. So not seeing them is a good thing for us. It can be good or bad, but if they're coming out of rehab, you know, we're going to take that win that they're not injecting drugs anymore. All right. So just to give you a little background about how the legalities of syringe service programs in the state of Louisiana. As you can see, in 2017, the State of Louisiana Legislative session, this House bill was passed. This allows any local municipality to authorize the establishment and implementation of a needle exchange program within their jurisdiction. So, and then Governor Edwards signed this bill June the 30th of 2017, and it was effective immediately. And as soon as that was effective, we got to work. So we were not very fortunate like the underground, our sister underground organizations like Tristerio, and then NOSAP, and then CART that's in Baton Rouge. You know, they were already operating and have been doing, you know, providing this service to their community for years. So we utilize a lot of their protocols and procedures, and then, you know, into our program. So we didn't have to reinvent the wheel at all. So here are the numbers, here are the people that were at the table, you know, for when we were getting the syringe service program started. So we had our city councilman, Jeff Everson, for our district at that time, sponsored our bill. He gave us great advice as how to proceed into getting this bill approved at the city council. We did a lot of education at his, you know, he wanted us to educate people about syringe service programs. Assistant City Attorney Danielle Farr was there. The Assistant District Attorney was also there. She was the Assistant District Attorney. They are the ones that do drug courts. So we wanted to make sure that we had everybody on board as far, you know, and at the table in order to make sure that we were educating the right people and just, you know, having the support of the people we needed to have. CADA was there, the Center of Behavioral Health, the Shreveport Police Department. Ben Raymond was he was the interim at that time. So once we got it approved and everything, he became the Shreveport Police Chief. So as you can see, this is just a little excerpt of our of the ordinance that was approved for us for needle exchange programs. And as you can see, this is, you know, the authorization in order to provide this service in the city of Shreveport. One of the things that we had to put in place is that each one of our participants has to have an identification card. So that way, if they get stopped by the Shreveport Police Department, you know, the patrolman or woman knows, hey, this person is a participant of the Philadelphia Syringe Service Program. So they cannot be charged with a paraphernalia charge. And that was super, super important for us to make sure that we provided that layer of protection for our participants. And then also this community is not very trustworthy. And so once we tell them, the first time that they come in and everything, once we tell them that, hey, this card protects you from a paraphernalia charge. So always make sure that you have it, but it is only acceptable in the city of Shreveport. It does not work in Bossier or Minden or Benton or any other municipalities. So since I love data, I'm going to provide you with some data demographics of our participants that we serve. So since our program opened, we opened January the 30th of 2020 in the middle, right when COVID started. And we continue to provide services for this particular program since we had been talking about it so much and telling people, hey, we're starting in January or, anything like that. So we didn't want to shut this program down just because of COVID. We just maneuvered around it and did like a window service. So they could come to a window and say, hey, I need this many syringes and I need these supplies. And then I would pack it up for them, pass it to them through the door, and they were on their way. So since we opened, we have 274 participants enrolled. In 2020, we distributed over 112,000 sterile syringes and disposed of 12,000. So year to date, these are May of 2021 numbers. At the end of May of 2021, we've already distributed over 103,000 sterile syringes, and we've already disposed of almost 11,000. So the word is getting on the streets that we are opened, and we are here for our participants to provide safe injection equipment to them. And we don't do any marketing whatsoever. It's all, the community is the one that spreads the word for us. So all of our naloxone that we distribute is provided to us by CADA. They have a grant through the Office of Behavioral Health. I believe it's the LaSore grant that supplies them with any naloxone that they need. So we've got a great working relationship with them that they provide all the naloxone to us that we need to distribute. So in 2020, we distributed 357 doses of naloxone, and it was self-reported to us that it was used 62 times to reverse an overdose. And so year to date in 2021, we have already distributed 586 doses of naloxone with 60 self-reported uses for overdose reversals. So we'll talk about gender of what the demographic makeup is for participants. As you can see, a majority of the participants are male and about 34% are female. The other 1% is they're considered gender fluids. So sexual orientation, you can see, heterosexuals make up about 64%. Lesbian and gay community makes up about 19%. We have 3% queer, 10% bisexuals, and then 4% others. And then as far as the race goes, 83% of our demographic is white, 10% is Black, and then 5% is other. And that includes a lot of multiracial backgrounds. So for HIV status, as you can see, 80% stated that they're negative for HIV, and we have 7% that are living with HIV at that moment, and then 13% didn't know what their status was. For hepatitis C, there's 20% of our demographic that is positive for hepatitis C, 19% didn't know, and then 61% were negative. So I always find that this is something that's super important for us to kind of know about our participants of their frequency of injections per day. This helps us to determine how many sterile syringes we need to provide them, or with kits, or anything that we may need. Mandy, do you know why that yellow line is there? Okay. So secondary exchange, this means the number of people that they are providing syringes to. So say, for instance, we've got 27% that says that it's just them. And then we have, we have 57% that provide sterile syringes to 2 to 5 other people who are injecting drugs. And then 6 to 9 is 6%, and then 10 plus is 10%. So based upon, our participants' needs, and if they are distributing for us, we will give them additional boxes of syringes. So, and depending on the injection frequency and the secondary exchange for, an individual, depends on if they'll get 100 or 150 or 200. I have one guy that I provide 400 syringes to, at one time, and he comes almost every single week because he distributes that many syringes out for us. And that helps us build a level of trust with people that have not walked into our front doors and do not trust, that we're not going to turn around and turn them in or narc them out or anything like that. So, and it takes time to build a level of trust with this particular community. So just some of the items that we offer at our syringe service program. We provide the sterile syringes, kits, hand sanitizer, fentanyl test strips, naloxone, wound care kits, and safe sex tools. And with safe sex tools, I mean by condoms and lubrication, dental dams, and female condoms. And wound care kits are provided to our participants that that gets like abscesses. So it has some Coban wrap in it, some gauze, and some gloves in it. So that way, if they get an abscess, we give them some printed material that shows them how to take care of that abscess. And if it starts getting warm, they also need to, if it starts getting warm, they need to head to the emergency room. A lot of our participants will not go to an emergency room. So this is one reason that we provide wound care kits and informational documents to them of how to take care of abscesses or how to reduce the risk for those. Okay, so these are the different syringe sizes that we provide to folks. And this is all on a board. I'm kind of arts and crafty and everything like that. So, and this just shows them a little bit of information, what is a, what's going to be longer and thicker and what's going to be shortest and thinnest for them. So, and a lot of our folks have a tendency to go towards the right side because we have a majority of the folks that we provide sterile syringes to are methamphetamine users. So the longer and the thicker syringes are typically for, folks that inject heroin, or they have been using drugs for long periods of time. Okay, So we give out these little kits that have sterile waters, little cookers and twist ties, ointment, little cottons, straps, alcohol pads, and bandages. So people are like, they look at the cookers and the twist ties and they're like, well, what is that for? Well, some of our participants have to put down their drugs. And so this replaces the spoon that they're carrying in their backpack or in their bag or in the back of their pants. So anything that we provide for them is the most sterile items that they can get. So. All right, so we operate every Friday from 10 a.m. to 4 p.m. Our address is 2020 Centenary Boulevard, and our SSP hotline is listed right there. And I man that hotline. Sometimes when people, can't get up there on a Fridays, they can give me a call and we can arrange another pickup time for them. All right. That's all for me. Any questions and comments?
Thank you, Hershey. I think we actually have a few questions that came up in the chat. I know you touched on this, but maybe if you give some more details. How did we get a syringe services program here in Shreveport? And can anyone start up their own SSP?
So we already have one in Shreveport. We do not have one in Bossier. So, it is up to the local municipalities to decide whether or not they want a syringe service program to operate in their area. And the ordinance states that any nonprofit or community-based organization can start up their own syringe service program. And I welcome anybody that needs any assistance with that to please get in touch with me, and I'll be more than happy to help you through that process.
Okay, yeah, because that was actually the next question was how can I get a program for Region 3?
Region 3 is, what is Region 3? Hammond area? Is that the Hammond area?
Might be.
LaFouche Parish, Terrebonne, Thibodaux area.
Sorry, I couldn't get it to type. I was trying to type it in this question section. Yeah, it's Terrebonne Parish, St. Mary Parish, St. James, St. John, LaFouche, St. Charles. It's in the southern part of the state.
Okay, so do you have a connection with anybody that is on your city council or on your parish council?
Yeah, yes, I do.
Okay, so that's where I would start right there, because that's what we did, is that we went to our city councilman and asked him, hey, this is something that we want to get started. Here is all the information and the materials that you need to know, as far as operating a syringe service program, and what New Orleans did and Baton Rouge did. So our ordinance is based on their ordinances. And I'd be more than happy to share any materials that I have, so you don't have to, do that research yourself. We were very fortunate to have a Master's of Public Health intern who put a whole entire binder for us together. It was amazing what she did. So, so I'd be more than happy to share any of those resources, but you need to go ahead and start talking to your connection at the city council or at the parish government level.
Okay, yeah, I know I know a lot of them. Also, the parish president I've been knowing for years, so okay. I don't think I have a problem. It's kind of like Terrebonne Parish. We have some bad pockets on the east side. It's also, it's bad in an area where they have the weed and seed program, which if you know anything about the weed and seed, that's where it's for children. It's a program that's kind of for juveniles to have positive activities. But unfortunately, there's a lot of drug activity in the area so we, I'm trying to get some things going there. And and in Lafourche Parish, there's a park in Thibodeau where they've had problems where they've found syringes, and they have a beautiful playground there. But, it's like if somebody just throws a syringe and a young child, accidentally steps on it or whatever. So,
Absolutely. That is, we took about a year and a half to educate our city council and the Shreveport Police Department and the DA's office and the city attorney's office. We were very intentional on taking the time to let them, really receive the information and really digest the information, because once we started throwing all the statistical data at them, it started to, we would come back to the city council meeting and they're just like, oh yeah, well, I was on a run the other day at Betty Virginia Park or something like that, and there was a syringe on the ground. And so, this type of program helps to clean that up, because we provide these sharps containers for our participants to dispose of. Now, we could do a better job of getting more syringes back, but I'm talking to the participants every week about, maybe having an incentive for them, to bring back their sharps containers.
okay.
So, but I'd be more than happy, Harvey, if you want to just send me a quick email. I'd be more than happy to send you all the information that I've got, and to also connect you with Allison Gay. She is the Louisiana Department of Health statewide syringe service coordinator. We got a lot of information from her, and she can help you navigate through the policies and come and advocate on your behalf to any, government meetings that you need to be at. She's super, super knowledgeable. She ran NOSAP, Crescent Care's syringe service program for years before she started working with the state. So,
Okay.
and she worked very tirelessly with getting some funding for us for the syringe service programs in the state of Louisiana. So we love her. So
Okay. Yeah, I'll definitely get back with you. I'll send you an email and I can start working on that. Definitely.
perfect. Yes.
Thank you so much.
Because you're welcome, because we don't want you to have to reinvent any wheel whatsoever, because the information is all out there, and it's all been compiled by every single region, that has a syringe service program. Especially, Alexandria is our newest. Lake Charles is now working on getting theirs legalized right now. So we're super excited for them. And I want to say Lafayette is also working on theirs as well.
Okay. Good. Thank you.
You're welcome.
All right, if anybody else has any other questions, please feel free to unmute yourself, or you can type it in the chat. No other questions for Hershey? All right, well, Hershey, thank you so much. That was a fantastic presentation. It was definitely a lot of great information that you shared. I do want to remind everybody that there will be recording of this session on our website at bossierlibrary.org/community conversations. Want to thank you all for attending our Community Conversations webinar series.